This is Alex. He's an OEF/OIF vet. He's always been the guy that others could count on. That's why he joined the military, to do his part to give back. Shortly after returning from Afghanistan, Alex started feeling down and moody. He's also not interested in doing things he used to enjoy. All of these signs are symptoms of depression. Alex wants to be better, but doesn't know where to start. He hasn't reached out for help because he feels he should be able to take care of his own problems. Then, Alex remembered seeing changes in his friend Joe, a fellow vet. For a while, Joe wasn't himself. He seemed quiet and stayed home a lot. But recently, Alex noticed he's been more like the guy in the Army they called Happy-Go-Lucky Joe. Alex mentioned to Joe that lately he seems more like his old self. Joe said he'd tried a type of counseling called cognitive behavioral therapy, CBT, for depression. Joe said it helped him get back to feeling like he used to. People with depression like Joe and Alex tend to see themselves, the world, and the future in pretty negative ways, as if they're looking through dark or foggy lenses. For example, Alex believes he'll never amount to much and worries the worst will happen in situations. The lenses through which Alex sees himself and his life are dark and dim. People with depression also don't do much that give them joy or meaning. This is both the cause and result of depression. For Alex, this means spending time at home, watching TV and staying in bed, which makes him feel worse. These two areas, thoughts and behaviors, are where CBT comes in. CBT teaches powerful thinking skills for clearing up the lenses through which people with depression see themselves and the world. It also involves figuring out and doing more pleasant activities, which creates fuel for one's mood. After hearing about Joe's experience with CBT, Alex decided to give it a try. He worked with his therapist, Lisa, to help him notice and change his negative thinking, and to figure out and plan activities that make him feel good about himself. CBT has been shown to be effective in treating depression in hundreds of research studies. And it has helped many vets, sometimes after struggling with depression for many years and after trying other treatments. CBT usually works in about 12 to 16 sessions, and because it teaches new skills, the benefits usually last. So, if you're feeling down or not quite yourself, you can turn things around like Joe and other vets. Learn more about CBT for depression and see how CBT turned out for Alex at Treatment Works for Vets.